Our group did the spread of the HIV epidemic, and our group members are Ethan Boyd, Morgan Carpenter, and Jake Jeffries. HIV is a virus that is spread through certain body fluids that attack the body's immune cells, specifically the T cells. T cells are special cells used to help fight off disease and infections. There are 3 stages of HIV. The first stage is acute HIV infection, which occurs with flu-like symptoms about 2 to 4 weeks after prior infection. The second stage is clinical latency, which is typically when medication is induced and the HIV is still active in the body, but it reproduces at extremely low levels. And the third stage is AIDS, and without treatment, there's a survival rate of only 3 years. Currently, there's no cure for HIV, but there is a treatment called ART, which, if used correctly, can have their patients have a long, happy, normal life. There's a lot of misconceptions about how one can acquire HIV. The only ways that are promoted by the CDC is that you can get HIV through sex without a condom, sharing injecting equipment, contaminated blood transfusions, and the passing of an infected mother's HIV to her baby. You cannot get HIV through things such as sharing saliva or sharing food, kissing, any sort of saliva or like sneezes. That's just not true, and it just adds to the stigma of the virus. The history of HIV, it's said that the source of HIV came from a type of chimpanzee located in West Africa. It was transmitted to humans when the humans hunted these chimpanzees for their meat and came in contact with their infected blood. However, in 1959, that was when the first case of HIV in a human man, was found in the Democratic Republic of the Congo. From there, the HIV virus slowly started spreading around the continent of Africa and then globally. In the 1970s, doctors started reporting unusual cancers and diseases, which normally an immune system can fight off in a bunch of homosexual men in America. That is when it was realized that the AIDS virus came to the US, and that's when the AIDS epidemic began. And not only did this virus affect the health of these people that were infected with it, but it also created a mental health stigma surrounding them. And this is a stigma commonly seen in gay/bisexual men because in a study done, it was said that the people who have gotten HIV, they stopped believing to themselves to be as once socially significant as they were.
For the age and gender groups, on the right, there's a graph that shows a brief summary of it all, covering the total amount of people who have it from adults to the comparison of adults to children and the comparison of women to men. As you can see, women and men are fairly equal, along with at about 18 million, whereas children are about 1.7 million. And for a majority of these people, especially for children, they often get their version of the HIV virus from their mother, who passes it down through birth. And as you can see on the far right of the graph, about 770,000 deaths total, and about 1/7 of that is accounted for by children, which is under the age of 15. So that's a large portion of the HIV related deaths that occur. When looking at a comparison of regions, you always want to compare. One of the big things we wanted to compare was who has HIV, and in turn, who has treatment available to help them fight HIV. So one of the things we looked for was a comparison of overall regions, and we found that Africa has the highest amount of people living with HIV, which could be due in part because that's the origin continent of where the virus began. However, they also have only 16.3 million of those people who have HIV are receiving the uh, retroviral antiretroviral treatment. So majority of those people are left to suffer with the virus's damages to their body. Whereas when looking at more developed areas such as Europe, the Americas, they have a higher percentage of those people who have HIV actually receiving the treatment. And when you look at it in Africa, about majority of those cases come from Southern Africa, with South Africa being one of the main epicenters of the virus. And then you have and then in comparison, looking at North America, you have US having the highest percentage of HIV virus compared to their population out of Canada, Mexico, and themselves.
Yeah, in an HIV breakdown in the U.S., it's estimated that 1.1 million people had HIV in 2016. 86% of those people were diagnosed, 64% were receiving care, about half were retaining care, and slightly more than half were virally suppressed due to ART treatments. The main thing to discover from these demographics is that while most people in the U.S. have been diagnosed, only about slightly more than half are receiving care, as many more treatment centers need to be established further in the south and the western half of the country, as they aren't receiving as much care as they should. In a continuation of the statistics, the average lifespan of a person who doesn't have HIV is about 80 years. And compared to those who have HIV without treatment, it's down to 32 years. But with treatment, their lifespan doubles to about around 70-ish, showing how technology and medical equipment have improved throughout the years. And a further breakdown for social demographics by HIV, there's about 38,000 to 39,000 new diagnoses in the US every year, with about 70% of those cases coming from gay and bisexual men, with majority being broken down into African American groups, Latino groups, and then Caucasian and Asian groups. Yeah, for our methods, we collected data from organizations such as the CDC and WHO, and read through their reports and data analysis to find their findings on HIV trends and statistics to see what things were currently happening and for medical findings that they had discovered, and then added that to our further discussion and research.
For the group contributions, we all equally did the work. We split it into three sections, and each person pulled their weight and was held accountable.
And just to conclude the paper / presentation / video that we've worked on, the disease, the virus, HIV, has been around for decades, and the stigmas behind it are often misled. It's grown to the point of being a virus that affects everyone, not just those in the gay and bisexual communities and the homosexual communities in general. And so far in the world, as you've seen from this presentation, it affects millions of people. It affects their day-to-day life. And a major part of what makes this virus so scary is that it's, in a sense, it's still an unsolved mystery. There is no technical cure. The antiretroviral treatment is the closest thing we have so far, but there have been many studies done in different parts of the world, and all of them seem to have the same issue of being able to find medicine or technology that can work to find a one-time cure for the drug. So it's important to recognize the dangers of HIV and the stigmas that are true and aren't true behind it.